How do testicular cancer patients return to full active lives after RPLND? Recovering from a retroperitoneal lymph node dissection can seem daunting, but with proper care and patience, many men successfully return to their normal routines. After this major surgery, which involves removing lymph nodes from the back of the abdominal cavity to treat or prevent cancer spread, the journey to full activity starts in the hospital. Patients usually stay for several days, during which their bowel function gradually returns. Doctors monitor vital signs and wound healing closely, and pain is managed effectively. Early movement, like walking around the hospital ward, is encouraged to reduce risks such as blood clots and lung infections. Side effects like groin or abdominal discomfort, swelling, and fatigue are common but manageable. During surgery, nerve-sparing techniques are often used to preserve sexual function and fertility, but some men may experience temporary or lasting changes in sexual health. It's important to discuss these possibilities with your healthcare team beforehand. Most patients can begin light activities within 2 to 4 weeks after surgery. Heavy lifting, vigorous exercise, or strenuous physical work should be avoided for at least 4 weeks to allow proper healing of the abdominal muscles and incision site. Robotic or laparoscopic procedures, which involve smaller incisions, often lead to quicker recoveries and earlier resumption of daily activities compared to open surgery. Follow-up care is essential. Regular visits with your doctor, including imaging tests like computed tomography scans and blood tests, help monitor for any signs of recurrence. These checkups are usually scheduled every 3 to 6 months during the first 2 years when the risk of cancer returning is highest. Physical therapy can be very helpful in rebuilding strength and endurance, especially if you experience muscle weakness or fatigue. Emotional support or counseling can also be beneficial, as adjusting to life after cancer treatment can bring emotional challenges. Fertility is a key concern for many men undergoing treatment. Sperm banking before surgery is often recommended, especially if nerve-sparing techniques are not possible. While these procedures aim to preserve fertility, it's important to discuss your options with your oncology and urology specialists. In summary, returning to full activity after RPLND involves a step-by-step process guided by medical professionals. Managing pain, side effects, and emotional health, along with gradual physical rehabilitation and ongoing surveillance, helps men regain their strength and quality of life. Advances in minimally invasive techniques like robotic surgery can shorten recovery times and make it easier to get back to normal. Remember, each person's recovery is unique, so personalized care plans are essential. Always consult your healthcare team for advice tailored to your specific situation.